Okay, so today we will start schizophrenia. Clear? So, first of all, history of schizophrenia. The history of schizophrenia is given by the M.L. Carpet, an eminent psychiatrist in 1896, is formed by the concept of dementia, precox mental deterioration in 1911. Agent Bleuler coined the term schizophrenia, which means the schizophrenia word is divided into two. Schizo means split and phrenia means mind, means to say splitting of the mind. So after that, next one is a Kurt Standard described the 11 symptoms collectively called as first rank symptom. FRS who presents absence of cause of brain disease was diagnosed of schizophrenia. Next one, we have discussed about the definition of schizophrenia. The definition of schizophrenia in which there is a alteration of the mood, thinking and behavior. So in which there is the mood is bizarre and it is characterized by it is a disorder that is characterized by the general fundamental symptom and characterize the deterioration of thinking and perception and by inappropriate or blunt affect. The most intimate thoughts, feelings, and affect are often felt to be known or sharing by others, and explanatory delusions may devolve to the effect that natural or supernatural forces are at work to influence the affected individual's thought and action in ways that are often bizarre, means to say in which there is alteration of the perception, in which there is the development of the illusion and hallucination disorders, and it lead to the schizophrenia. So next is a schizophrenia is a psychotic condition characterized by a disturbance in thinking, emotion, volitions, and the faculties in the presence of clear consciousness, which is usually lead to the social withdrawal. The main symptom of a schizophrenia is leading to a social withdrawal, means to say disconnection from the society. So after that, next we have discussed about the ICD classification of schizophrenia. ICD means to say International Classification of Disease and Disorders. So under that, the schizophrenia comes under the F20 to F29 classification. It includes schizophrenia, schizotypal and delusional disorders, in which F20 schizophrenia, F20.0 paranoid schizophrenia, F20.1 hebephrenic schizophrenia, F20.2 catatonic schizophrenia, F20.3 undifferentiated schizophrenia, F20.4 post-schizophrenic depression, F20.5 residual schizophrenia, F20.6 simple schizophrenia, and F21 is schizotypal schizophrenia. So this is a detailed description according to the International Classification of Schizophrenia. So after that, we have discussed about the epidemiology behind the schizophrenia. The epidemiology behind the schizophrenia is, it is a most common of all psychiatric disorders and it prevalent in all cultures across the world. 15% of new admissions in mental hospitals are schizophrenic patients. The ratio is 15%. The schizophrenia patients occupy 50% of all mental hospitals and beds. About 3 to 4 per 1,000 and every community suffer from the schizophrenia. This is a epidemiology behind the schizophrenia. Next one is but etiology behind schizophrenia, means to say what are the etiological factors that lead to schizophrenia. So the first etiology behind the schizophrenia is biological theories. Under the biological theories, biochemical theories, in which the dopamine hypothesis and excessive of dopamine, it leads to the schizophrenia and dependent neural activity in the brain may cause schizophrenia. And other biochemical hypotheses, it includes abnormalities in the neurotransmitters, norepinephrine, serotonin, acetylcholine, and the gamma aminobutyric acids are abnormality. These all are lead to the schizophrenia. This is a etiology behind the schizophrenia. So next one is a genetic theory also lead to schizophrenia. So under the genetic theory, the more common among people born of consanguineous marriage and identical twins affected 50% of schizophrenia, as well as fragmental twins affected 15%, brother sister affected 10%, one parent affected 50%, and both parents affected 35%. Leading cause of this is a genetic theoretical leading cause of schizophrenia. Next one is the perinatal risk factor. The perinatal risk factor is lead to schizophrenia. Under the maternal influenza, if the mother is suffering from influenza condition, then it is lead to the schizophrenia. Next one is the birth during late winter, early spring. It lead to schizophrenia, complications of pregnancy, and particular during any condition. So it lead to the schizophrenia. Next one is a psychodynamic theory. It also lead to the schizophrenia. So under the psychodynamic theory, developmental theories like according to Freud in the psychosexual development. So as we have previously discussed, the psychosexual developmental stages are five: oral, anal, phallic, latency, and genital stages. So under that will lead to the schizophrenia, inadequate ego development, and superego. These all are functional abnormalities, and these all are lead to schizophrenia. Next one is a family theory. The family theory, the mother and child relationship. The mother of the schizophrenia as old, overprotective, dominancing, thus retarding of the ego development of child lead to the schizophrenia. And psychopathology behind the schizophrenia. The psychopathology behind the schizophrenia is there is a combination of the genetic predisposing, environmental, social, and the psychological factor. Further, it lead to the neurodevelopmental abnormalities and target features. It further lead to the brain dysfunction, improper balance of the chemical, and further it lead to the schizophrenia, means to say splitting of the mind and withdrawal from the society. Next one, we have discussed about the phases of schizophrenia. So under that, the phases of schizophrenia is further divided into three, like prodromal, psychotic acute phase, residual chronic phase. The prodromal phase decline in the functioning that proceeds first psychotic episodes, social withdrawal, irritability, physical complaints, and newfound interest in the reasons that occur lead to a schizophrenia. Next one is a psychotic acute phase. Under that, positive symptoms, perceptual disturbances, for example, in which various type of perceptual disturbances means to say the person is unable to perceive the environmental stimuli like illusion, hallucination, auditory hallucination, etc. And delusion also occur in a psychotic in acute phase. Means to say false fixed beliefs which are irrational and not related to our reality. Next one phase is the residual chronic phase of schizophrenia. Under that occur between episode of psychosis marked by the negative symptoms affect social withdrawal or thinking and behavior. It lead to the these all are phases of schizophrenia. Next one is after the phases clinical features of schizophrenia, means to say those persons are suffering from a schizophrenia, various type of signs showing by the body. So the first major clinical features of the person are having schizophrenia are the four major clinical features are. So first one feature is according to the 4A. It is given by a blurred 4A symptom, that is a so-called fundamental symptom and first frontal symptom of a schizophrenia. Under that 4A affect in which flat and blunt effect. Autism. Autism means to say the person withdraw into self, lose of association. The person is lose of association and disconnection from the society. And ambivalence. Ambivalence is same like conflict. So these all are a major symptom showing by a person who is suffering from a schizophrenia. So next showing a symptom by a body who is suffering from a schizophrenia are, so these all are positive symptom and negative symptom. The positive symptom showing by a person like hallucination. So as we know, hallucination in which auditory hallucination, visual hallucination occur, delusion also occur. The person are having false fixed beliefs, formal thought disorders, odd or bizarre behavior, negative symptoms. Under a negative symptoms, flat effect, allosia, anhedonia, aversions, inattention, and self-care deficit symptoms showing by a person who is suffering from a schizophrenia. The next first rank symptom of the person are having schizophrenia. So first one is the auditory thought, voice arguing, voice commenting on first action, thought withdrawal, thought insertion, thought broadcasting, made feeling, made impulses, made volitions act, delusion perception. So perception means to say the person is unable to perceive anything with the help of sense organs. So the person are having perceptual disorder in which it may be a form of illusion or hallucination. Next one is a somatic passivity. So these all are a first rank symptom showing by a person who is suffering from a schizophrenia. So next one is a after the symptom, thought and speech disorder symptom showing by a person who is suffering from a schizophrenia. So the disturbance of thought and speech in a person, the various symptoms like autistic thinking. So autistic thinking means to say the person withdraw into self. He or she is not knowing by the reality which is happening in the environment, like losing of association, thought blocking, neologisms, poverty of speech, poverty of ideation, echolalia, preservations beyond of point of relevance, verbigurations, like these all are a symptom by a person of schizophrenia. Next one, after that, delusion of persecution, grandeur, reference, control, infallibility, somatic delusion, bizarre behavior showing by a person who is suffering from a schizophrenia. Next one is a over-inclusive, impairment, abstract thinking, completeness. Next one is a disorders of perceptions are having various type of a disorder of a person who is having schizophrenia condition. So hallucination in which auditory hallucination, visual, tactile, gustatory hallucination and olfactory hallucination occur. Next one is a disorder of affect in which apathy. Apathy means to say absence of feelings and emotions. Next one is a emotional blunting, emotional shallowness, anhedonia, inappropriate emotional response, etc. These all are the symptom which is affected by a effect of the person with schizophrenia. Next one is a disorder of motor behavior in which increase and decrease in a psychomotor activity, mannerism. Mannerism, as we previously discussed about the terminology of psychiatric, mannerism is to say in which person repetition of the activity habitual kind under stress. Grimacy, stereotype speech means to say combination form of a echolalia and ecopyrexia in which repetition of a movement and speech habitual kind under stress. Next one is a decreased self-care. Next one is a poor grooming. These all are a disorder of motor behavior of a person with schizophrenia. Next, other feature showing by a person who is suffering from schizophrenia, like decrease in work function, decreased social relationship, means to say deprived from the society relationship, decreased self-care, he or she is unable to do self-care, inability to concentrate on anything, tension occur, insomnia, withdrawal of cognitive defect, loss of ego boundaries. The ego of the person is lost due to schizophrenia. So next one is a so after that loss of judgment, poor judgment, suicidal, presence of association, depression, command hallucination in which auditory and visual hallucination occur. After that, the major symptom showing by a person with schizophrenia, that is a ABC symptom of schizophrenia based on the clinical feature. In a ABC symptom, A means autistic thinking, ambivalence, anhedonia. As we previously discussed in a fundamental blur for a symptom, the first rank symptom is the autistic ambivalence, affective disturbance, and associative looseness. The ambivalence is same like conflict, and the person are having contradictory and opposite idea situation. Next one, B means blunt affect. C means catatonic behavior of the person, in which it may be a form of catatonic stupor and catatonic excitement. Next one, D means delusion. Next, E means echolalia, ecopyrexia, and behavior and excitement. F means functioning in work is decreased and frank incoherence. So that is a A to F symptom according to ABC symptom of a schizophrenia based on clinical feature. Next one is a G. G means grimacing, grooming is poor, gilling. H means hallucination, hostility. Next, I means illogical thinking, impulsive behavior, irrational ideas. J means judgment is poor. L means losing of association, loss of ego boundaries and insight. M for mannerism. Mannerism means to say repetition of a movement, habitual kind under stress, made impulses, feeling, volitions and acts. N means neologism. Neologism means to say person use a new meaning which is special meaning for a person. Next, O means auditive behavior. P means preservation, poverty of speech and ideation. R means rigidity. S means somatic passivity and suspiciousness toward any person, in which stereotype speech, societal ideation, social withdrawal. And next one means T means thought block, insertion, broadcasting, withdraw thought, echolalia. B means verbigrations, vague, hypochondrial means to say the person is overconscious about health. W means waxy flexibility, wandering and tendency. Next one is a clinical types of schizophrenia. So there are various clinical types of schizophrenia in which the person are having who is suffering from schizophrenia showing various type of clinical features. So it is also called the type of schizophrenia. So there are various type of schizophrenia like catatonic schizophrenia, in which catatonic stupor, catatonic excitement occur, residual schizophrenia, habiphrenic schizophrenia, paranoid schizophrenia. So first of all, we have discussed about the paranoid schizophrenia. So paranoid schizophrenia means to say those person are having in which the main symptom showing by a person who is suffering from paranoid schizophrenia is showing suspiciousness towards any another person. Means to say, paranoid means delusional. Paranoid schizophrenia is at present the most common form of schizophrenia. It is characterized by following feature: delusion of persecution, means to say he is showing suspiciousness towards any other person, obstructed in pursuit of long-term goals of the person, and in which the delusion of jealousy occur of the person who are having from paranoid schizophrenia, like the person's sexual partner is unfaithful. Delusion of grandiosity occur in which like irrational idea regarding their own worth, talent, knowledge of power may be believed to other person and blame to other person. Those are having paranoid schizophrenia. And next one is a habiphrenic disorganized schizophrenia. So habiphrenic disorganized schizophrenia, it is a important type of schizophrenia in which it has an early and insidious onset, and it is often associated with poor pre-morbid personality. The essential feature including thought disorder, incoherence, severe losing of association, extreme social impairment, etc. occur in that. Next one is the catatonic schizophrenia. The catatonic schizophrenia means cata means disturb. It is characterized by marked disturbance of motor behavior form. It may be further divided into the catatonic schizophrenia is catatonic stupor, catatonic excitement, and catatonic altering behavior and excitement to others. The catatonic stupor means to say the person showing same symptom like in catatonic stupor, the person showing same symptom like depression. Like in the depression, there is decrease the activity of mood, thinking, and behavior. So same like symptom showing by a person who is suffering from a catatonic stupor. Next one is the catatonic excitement. So in the catatonic excitement, the person showing the same symptom like mania. In mania, there is increase the activity of mood, thinking, and behavior. So sometimes the activity is decreased and sometimes the activity is increased. So it is a further type of catatonic schizophrenia in which alteration of the mood, thinking, and behavior, and further it is divided into three parts. So this one type of a reaction showing by a catatonic schizophrenia. Next one is a residual schizophrenia. The residual schizophrenia is a main type of schizophrenia in which symptom including like emotional blunting, inanimate behavior, illogical thinking, social withdrawal, losing of association. This category should be used when there have been at least one episode of schizophrenia in past but without prominent psychotic symptom at present. So this is comes under the residual schizophrenia. Next one is a undifferentiated schizophrenia. This is another type of schizophrenia. In this is the category is diagnosed either when feature is not subtypal are fully present on features of more than one subtype are exhibited. So it is comes under the undifferentiated schizophrenia in which the symptoms are not described. Next one type of a schizophrenia is a simple schizophrenia. In simple schizophrenia, the person showing various type of reactions like early and insidious onset, progressive, course and presence of characteristics, negative symptom, vague hypochondrial features, wandering tendency, self-absorbed idleness, aimless activity. It differs from the residual schizophrenia in that there is never have been episode with all the typical psychotic symptoms. The prognosis of the simple schizophrenia is very poor. Means to say the rate of the recovery is low because there is a severe amount of the splitting of the mood, thinking, and behavior of the person. Next one, after the types, next one is a diagnostic evaluation of the schizophrenia. The diagnostic evaluation of the schizophrenia to diagnose of the schizophrenia. So as we all know, first of all, we have collected the history, means to say history collection from the patient and family member. So if the patient is able, then we have collected the history from the patient itself. So if the patient is not able, then we have collected the history from his or her family members. So after that, physical examination. Under the physical examination, we have followed the four methods to determine the symptoms of the person suffering from schizophrenia. Next one is a neurological examination done. Next one, mental status examination, blood investigation, in which various type of blood investigations we have done to find out the schizophrenia, like vitamin deficiency, viremia, thyrotoxis, electrolytes imbalance, organocytes. So these all are our diagnostic evaluations to find out the schizophrenia. And next one, diagnostic evaluation is CT scan and MRI, computerized tomography, and magnetic resonance imaging. It is a showing enlarged ventricles, enlargement of the salicy on the cerebral surface, atrophy of the cerebellum. Because due to the atrophy, there is an alteration of the mood, thinking, and behavior of the person. So after that, after the diagnostic evaluation, we have diagnosed various conditions. So we go for the treatment to treat the schizophrenia. So under the treatment modalities of the schizophrenia. So it is divided into medical and nursing, and first one of pharmacological treatment we have prescribed to treat from the schizophrenia. So under the pharmacological treatments, we given various type of drugs to treat the person from schizophrenia. So in which, like, commonly used atypical antipsychotic drugs like olanzapine 25 to 450 mg, risperidone, olanzapine, quetiapine, risperidone, antidepressant, sertraline, mood stabilizer drug like lithium therapies we have given, and another drugs we are given like pharmacotherapy, conventional antipsychotic drugs. So under the antipsychotic drugs, various type of drugs we have given like chlorpromazine 300 to 1500 mg day, 50 to 100 mg day IM, and fluoxetine dinthrone 25 to 50 mg we have given, haloperidol we have given, trifluorapentine 1 to 5 mg we have given to treat the person from schizophrenia. So these all are a pharmacological treatment. So we have given the person suffering from schizophrenia. So we have given these all are drugs according to the doctor prescription order. Next one, we go for the ECT therapy. So ECT, shortly I will explain about ECT. So it is a electroconvulsive therapy. It is given to the brain bilateral to temporal lobe for produce the grand mal seizure. The time duration of the ECT is 0.4 to 3 seconds, and it may be given unilateral or bilateral. So in schizophrenia, most of the psychiatrists prescribe the ECT to treat the schizophrenic condition. So the indication of the schizophrenia means to say in which conditions we have preferred, like catatonic stupor. So we have discussed previously, we have discussed about the type of schizophrenia in which catatonic schizophrenia occur. So it is further divided into catatonic stupor and catatonic excitement. So we have discussed about the feature of catatonic stupor, in which the person showing same symptom like depression. So ECT is affected in the depression condition. Clear? So we have given in the catatonic stupor, uncontrolled catatonic excitement, severe side effects with drug, schizophrenic refractory. These all are a condition in which we have preferred the ECT therapy to treat the schizophrenia. So after the ECT, pharmacological treatment, ECT therapy, next we will prefer to treat the schizophrenia for psychological therapy. Psychological therapies we are given to change the faulty maladaptive behavior into socially adaptive behavior, in which various type of a psychotherapy we have given, like group therapy, behavior therapy, social therapy, cognitive therapy, family therapy, etc. In psychotherapy, group therapy, behavior therapy, social, and most of group therapy we have prescribed when the person in a combination form of the disorders. Then social skill training, in which social skill training we also given to the patients to treat the condition from schizophrenia, because the major symptom of schizophrenia is a social deprived. The person is deprived from the society. So in which psychological therapy we have referred for the milieu therapy is a mirror surrounding an environment to treat the schizophrenic condition. As we have referred the recreational therapy. So recreational therapy we have given to divert the patient's mind and listen the force the person for listen the music to relax the mind and relieve the symptom of schizophrenia. And family therapy, sometimes we are prefer the family therapy. The reason behind that, due to schizophrenic patient, the family member also disturbed, so that's why we prefer the family therapy also to change the faulty behavior of the family member of the patients toward the patient. Next one is after that we go for the nursing management. So first of all, go for a nursing intervention. So nursing intervention of a schizophrenia is in which we have assessed the various condition of the patient. So under the nursing assessment, First one, observe the behavior pattern of the patient, in which posturing of the patient, appearance, psychomotor disturbance, hygiene of the patient. Hygiene of the patient is necessary because due to the schizophrenic, the patient, the person hygiene is poor, he or she is not concentrate on himself or herself and for proper grouping up. So more concentrate upon the hygiene of the patient. So and identify the type of disturbance of the patient is experiencing. Ask the patient about feeling while thought altering and evidence. Note the effect and emotional tone of the patient and whether they are appropriate in relation to the thought of the present situation. Assess the speech pattern associated with the delusion. So speech pattern of the patient is also judged because due to withdraw from the society, the speech pattern of the patient is disturbed. So that's why assess the speech pattern of the patient. Next one, according to the condition and sign and symptom, we make a diagnosis of the patient. So first diagnose we will prefer according to the disease condition. So first diagnosis of the schizophrenia is disturbed thought process related to inability to trust, panic, anxiety, possible hereditary or biochemical factor, evidence by delusion, thinking, extreme suspiciousness of other. So that is the first diagnosis. Means to say the person thought process is disturbed. The reason behind that, the person is withdraw from the society and showing the suspiciousness towards the other, because the one type of a schizophrenia is the paranoid schizophrenia, in which the person showing suspiciousness. So due to suspiciousness, the thought process of the person is disturbed. So this is the first diagnosis. Second diagnosis of a schizophrenia is ineffective health maintenance related to inability to trust, extreme suspiciousness, evidence by poor diet intake, inadequate food fluid intake, difficulty in falling asleep. So second one is the poor health maintenance, ineffective health maintenance. Third one diagnosis of the patient is self-care deficient. The reason behind that, due to schizophrenia, the self-care activity of the patient is disturbed. So how we can observe the evidence behind that? Poor hygiene, poor dressing, poor grooming, eating disturbed eating and sleeping pattern, etc. So the third diagnosis of the patient is self-care deficient. Next one diagnosis of the patient is potential of the violence. So always person showing aggressive behavior towards any another person due to schizophrenic condition. So we have observed with the environment or self-destructive behavior. Next one is a risk for self-inflicted of the life-threatening injury related to the command, hallucinations, evidence by the society and suicidal ideas, plan or attempts. Next one diagnosis is disturbed sensory perception, auditory, visual related to panic anxiety. So we have observed the person are disturbed the sensory pattern by because of disoriented and withdrawal behavior from the society. So these all are a diagnosis of the patient with schizophrenia. Next one, so according to the diagnosis, we will provide the care to the patient to treat from the schizophrenia. And next one is a psychoeducation. So psychoeducation we have given to change the faulty psychology of the patient into healthy psychology and socially adaptive behavior. In which various type of things we have given, explain the patient and family that schizophrenia is a chronic disorder with symptoms that affect the person thought process, mood, emotion, and social functions throughout the person lifetime. So next one is teach the patient and family about the importance of medication campaign and the therapeutic, non-therapeutic effects of the antipsychotic medication. Means to say what are the adverse effects of the medication, what are the side effects of the medication on our body. These all are things should be explained to the patient as well as family member. Next one, psychoeducation is instruct the patient and family to recognize the impending symptom, extravagances, and the notified physician when the patient poses a threat, danger to the self or other required hospitalization. So means to say protect the patient from injuries and avoid the sharp instruments from the patient room. Next one is a teach the patient and family to identify the psychosocial family stressors that may exacerbate symptoms to the disorder and methods to prevent from the schizophrenia. Next one is a rehabilitation of the patient from schizophrenia. Rehabilitation means to say the person already suffered from schizophrenia and restoration of the function for normal living of the patient. So in the rehabilitation care, the focus on the psychiatric rehabilitation is strengthening self-care, promoting improving quality of life through relapsing prevention. It is an improved outcome by providing community family support service to decrease the hospital readmission rate and increase the community integration. Social skill training, vocational rehabilitation, halfway home, long-term home, closer supervision, day hospital, etc. So these all are a various type of like functional rehabilitation, vocational rehabilitation, social rehabilitation is given to the patient to treat from the schizophrenia. So this is all about schizophrenia. I hope you all understand very well. So in which I have concluded the schizophrenia, in which we have discussed about the history, introduction, definition, sign and symptom, causes, type of schizophrenia, and according to the sign and symptom, make the diagnosis and diagnostic evaluation. So we are go for a pharmacological treatment as well as we prefer the Ecd therapy and psychotherapy to treat the schizophrenia. And last one, we make a effective diagnosis for proper nursing intervention and applications to treat the schizophrenic disease condition. Thank you so much.